Good afternoon, everyone. I'm Gary Summers, and welcome to the audio edition of Mind, Body, Soul. I have a very special guest today, and many of you may have known her as a very successful woman oarsman in the St. John's Regatta, winning some 10 women's championships. But today she's here to talk about something different, not as an athlete, but as a doctor who spent 26 years in practice, most recently the last 9 months as a frontline worker, working COVID in Tennessee. Welcome, Dr. Siobhan Duff.
Thank you. Good to be here. Good to be in Newfoundland and on the show, Gary.
Siobhan, thank you very much. I know you're still home, but you're still working working a lot from home, and I really appreciate you taking the time to come on and kind of, I guess, give people some sense of exactly what's going on here, because you've been in the trenches with this for the last 8 or 9 months. You've seen some of the bad things that can happen when people catch COVID, haven't you?
Yeah, we have, unfortunately. Like I said, I've been home for the last number of months due to some family issues, some health issues with one of my parents. But certainly from March till September, we were right in the thick of it. Sadly, as you can appreciate, it's actually gotten much worse since I've been up here. But we'll be going back to it 1st of January.
Yeah. Siobhan, just give people a sense of, because we know coronavirus has been around for a while, and this is a new strain, a new novel, but can just explain, because it seems to affect people a little bit differently. Can you just explain what COVID exactly is?
Yeah, so COVID is one of, as you just said, a viral family that's been around for, I think I've read somewhere, they think 8,000 plus years, the coronavirus family, and has been identified to be around. Now, it is something that most people associate with a common cold, and some of the less sinister of its family would do just that, cause what we would sort of say seasonal cold. The coronavirus that we're experiencing is, as everybody knows, referred to as a novel virus, probably due to, to genetic mutation that has unfortunately made it a lot worse and a little bit more sinister than the viruses of past. It would be more similar to what people would remember from 2003, which was the virus originating from China that caused SARS.
Right.
So this is something more similar to that, in that it's the same family, but of a much more virulent, lethal, contagious nature.
Of the parents who are listening, and I know many parents, I don't know how many here, but I certainly know that a lot of parents have decided to homeschool their children, not sending them to school. And I've heard some doctors saying that kids are not super spreaders, and it doesn't seem to be much of an issue with kids. So can you just kind of set people's mind at ease with parents who got their kids in school who may be worried that this could be very problematic?
This is an area that we just aren't clear about. So I'm not sure that I'm in a position to set anybody's mind at ease. Suffice it to say, I think we are learning. One thing we do know is that children tend to be less severely afflicted when they get coronavirus, or COVID-19 specifically, I should say. They tend to not get as sick, although some cases of severe illness have been identified, as I'm sure everybody knows. They tend especially in the younger ages, not to be as capable of massive spread. We know this about the COVID-19 virus. It enters the body through something called an ACE receptor. It's a receptor cell in the upper respiratory tract of humans. It's much less present in children, so it's harder for them to catch. And they probably, and I'm saying, when you say children, I think what I've seen the American and probably Canadian pediatric societies do is stratify children into different groups, under 10 and over 10, or sometimes sort of even elementary school, middle school, high school. Children under 10 are probably much less of a problem. When children sort of reach double digits, their ability to spread the disease, they still are much less likely to become seriously ill than adults, but their ability to spread the disease becomes more similar to an adult model.
Okay, yeah, sure, yeah. So if I understand it correctly, young children, they don't develop this ACE receptor until they get much older. So there's no place for the coronavirus to attach to.
Less place.
Less place to attach to. Okay, so
yeah.
Some people say, well, I'll take my chances. most people only get mild symptoms.
Mhm.
And so what is it? Is there is there anything out there as to what is it? Is it a compromised immune system? Is it something that would cause some people to get very sick and other people that just have kind of like flu-like symptoms? Is there anything out there that distinguishes those groups?
I think that's one of the most fascinating parts of this disease. And I can say just from personal experience, and I've sadly had dozens of patients of mine, personal patients of mine affected. And you see younger patients in a quote safer demographic, 20, 30 years old, get seriously sick.
Yeah.
I've seen 90-year-olds come through it unscathed. So that's, like you said, that's the just incredible mystery of how this works. What we know across the board is there are certain risk factors. People who are older and people that carry comorbidities tend to fare more poorly. Men tend to fare more poorly. But as I said a minute ago, that doesn't always stand to reason. And I'm astounded and often very grateful as I've seen some of my older patients that are quite ill and quite complicated in their medical history come through it. I think, one of the markers that I think makes this virus different than, say, the flu. When this came to town, we thought, oh, this is a flu.
Yeah.
Even doctors were thinking this is just another kind of flu, a respiratory illness. Corona or COVID-19 appears to be more of a general systemic vascular process. And by that, I mean, this virus doesn't simply reside in the lungs. It enters through the nasal passage and lungs, but it disseminates through the entire body of an affected person. This is why we see these bizarre non-respiratory symptoms: gastro, vomiting, diarrhea. You don't normally get that with the flu.
Yeah.
We see rashes, we see blood clots, very, very high prevalence of blood clot, and many occur even after acute illness has resolved. Headaches, brain involvement, serious cardiac complications. And what we now understand, this virus attacks the general blood vessels, all in multi-organ systems of the body. So I think, just back to your original question, those people that are at risk for vascular problems are probably the most vulnerable. And that would be diabetics, people with high blood pressure.
Yeah.
That profile. I think too, when you look at how is it that somebody can walk into you can live with a person, be a spouse or a family contact.
Yeah.
The chance of contracting COVID is now recognized to be 30%. Isn't that crazy?
Yeah.
Whereas you can be in the Rose Garden during an outdoor event and you can have 100 people infected.
Yeah.
How does that work?
Yeah.
Those are some of the things we don't understand, but I think there are additional factors there, and probably it comes down to viral load.
Yeah.
How much of the virus a person intakes in a given exposure probably goes a great way to explaining why some people seem to have a brushing illness and some people have a more serious occurrence. Again, host factors, what that person comes to the table with in terms of comorbidities, and probably an element of chance.
I guess here we've been fortunate. We're an island. We've locked ourselves away. We're now not part of the Atlantic bubble, as two of us speak. Have we turned a corner on this, or we're seeing one case, two cases a day? Is when we look at specifically here where we are in Newfoundland, should we still be afraid of this? Vaccines are coming out now fairly soon, and so what would you say to people who really are very worried about this?
Well, I mean, I don't much to say to be afraid of it as to be respectful of it, Gary. I think, first of all, I will say this for what my humble opinion is worth. Newfoundlanders, the Newfoundland government and public health set have done an incredible, world respected job in the management of COVID-19. And I know it's been at some level exasperating and frustrating for Newfoundlanders, both here and abroad.
Sure. Yeah.
But they did what had to be done. And I think history will view back on this, and Newfoundland will be very proud of where they stand. Now, we are, as you say, nearing a light at an end of a tunnel, and that is access to vaccination. We are a ways away from that. I'm not sure. I think Canada yesterday approved gave emergency approval to Pfizer. I think you're going to see the population at large, those interested in vaccination, and I hope to goodness that'll be most everybody,
Yeah.
will probably have access to the vaccination by third quarter of 2021. I don't have a crystal ball, but I would
Sure.
say,
Yeah.
so we have a ways to go. I think the thing about Newfoundland that I find interesting, and I followed the numbers in the States as well as the numbers here pretty closely. Every case, perhaps with the exception of one 2 days ago in Cape Breton, has been identified as to where it came from. Where I've always said, and it's just me personally, where I would start to become increasingly uncomfortable is when they lose the ability to identify the source. Then you have the issue of community spread, and that's a harder situation. But as long as they are defining and confining and squatting and squishing out, virus, you're never going to be able to prevent that unless you literally have no human entry into the population.
Right.
But at this moment, they've seemingly allowed a transfer of people, of critical travel and people for various personal and occupational reasons, and yet been able to contain it.
Sure.
I have some level of ill ease about that because, humans are humans, and do we all do what we're supposed to do? Some do, some don't, most do. But I think if we can just hold the current mitigation strategies in place for just a period of time, the vaccine will be the deliverance, in my opinion.
So the vaccine now, and we know it takes years to develop a vaccine. I've heard some doctors, immunologists saying 8 years to develop a vaccine. COVID now is 8 months.
Mm-hmm.
Is there anything compromised in these drug companies, Pfizer and Moderna, in developing the vaccine that fast? Is it possible? Could they have missed something, or is it because people are saying it's safe, it's going to be safe, you can take the vaccine, even though some people, I mean, you look at the percentages, some 50% of people are saying they don't feel comfortable with the vaccine because of the perception that it was rushed. And because it was rushed, there's a possibility that checks and balances and something may not have been checked off. And what are your thoughts on that?
I'm not an immunologist, or an infectious disease specialist. I am, just a doctor. But here's my take on it. The vaccine type, first of all. So in most cases, when you've seen vaccines developed over history, they've been something called a live or a live attenuated vaccine, in which historically part of a virus pops up, we identify it, we put it in a tiny amount, we either dumb it down or kill it, and we inject it into the human body, and the human body then develops a response. That's how polio, measles, chickenpox, etc. developed immunizations. This is completely new. That's what's scary to people, I think, in that this virus type called a messenger RNA this vaccine type, I should say, does not rely on giving the body COVID or injecting us and letting us develop an immune system response. This type of protein is actually giving the body the genetic code for part of the coronavirus and then allowing the body to develop immunity to that blueprint. It's like a computer program. Now, that doesn't make it any more reassuring to somebody who thinks they cooked it up in a basement in 8 months.
Yeah, exactly.
You're like, really? That sounds good or bad? This vaccine model or platform has been under investigation for 25 years. It was being looked at by drug companies. It was in their pipeline for cytomegalovirus, for other viruses, HIV. This has probably got massive application for cancer therapy. If we can give the body the DNA code for a cancer cell and tell it how to kill that cell, that would be pretty cool. So you have basically a vessel into which they then came, along comes 2020, in comes the coronavirus. They've already got this platform waiting for the perfect viral candidate. Couldn't have found a better one than the one we're working with. Yeah. So it was more a situation where the background work, the scaffolding for this virus vaccination was already in existence. Now you have another couple of factors. You had also a vaccine for which there was massive international cooperation, huge funding, and you also had some efforts that were made to eliminate the bureaucracy, the paperwork. Usually a lot of things that happen in the vaccine world involve suits and paperwork and reports, and things are done serially. A lot of things were done in parallel. So they just pushed through a lot of bureaucracy. So you might have 2 months of science and 10 months of waiting, you know.
You're right,
so
right.
I don't have the impression that the science was any more rushed, but that a lot of the things that would normally hold up a vaccine process were condensed.
Okay.
If that makes any sense?
Sure, absolutely.
Personally, when I know the background of the type of vaccine that we are looking at, I also understand the relative safety of that, in as much as anybody does.
Sure.
I think it's that optic of rushed, as I was originally concerned, you know, back in March when nobody knew. We were all running around like chickens with our heads cut off. Nobody knew what was going to happen. But I think in the retroscope, this looks better to me. You know, I guess my other perspective on that, Gary, too, is what's our alternative?
Exactly. Yeah.
We've now had 2 cases in the UK with the concern raised for allergic reaction. So there's going to be, clearly, we're going to have to go as we learn. We're going to have to redevelop and redesign protocols, and perhaps these vaccines should be given in a medical setting. Perhaps people with certain subtypes need to be treated differently than others. But if you look at the potential danger of the vaccination compared to the long-term danger of COVID-19, even in survivors, I'll line up in a heartbeat.
Absolutely.
Personally.
Yeah, absolutely. Yeah, for sure. Because you know, where most vaccines, they were saying, you know, 70%, this one is 95%. So that's a pretty high, pretty high percentage. So Siobhan, let's get into a couple of things that I've read, and I'm sure you've heard some of this stuff about conspiracy theories, like, you know, the deep state is one conspiracy theory, where there's a government that's out to overthrow the government that's around, and they operate independently. And then there's the Illuminati, apparently, who have been conspiring to establish a new world order that would set up a single government to control the planet. And then there's the COVID-19 vaccine, where conspiracy theorists contend that the vaccine contains a device that allows government to track and monitor people. Can you bring some common sense to that theory?
Well, I can comment on it. Whether that'll change anybody's sense or common sense, I'll say this. I think, you know, in most successful conspiracies, there's often a grain of truth. So they can catch onto one thing and distort that thing and create fear around a fact. So as I understand it, with the Pfizer vaccine, as you know, that requires such a delicate delivery and a cold chain at a guaranteed temperature, there are tracking devices on the exterior carriers.
Right, that's what I heard, exactly.
That allow the government to understand and track where it is, which, if you can understand such an expensive commodity that has to be administered at such specific and delicate temperatures and conditions, that's important to know where it is and when it's there.
Right, absolutely.
That does not enter the human body, but there is a tracker, but it is not something that's clearly injectable or injected into the vaccine substance. So that's just defunct. It's just a misunderstanding of how that tracking process is occurring and how what it's meant for.
And that's probably where all this confusion came about, where someone might have heard something, and then all of a sudden rumors get around, and then people think that this has all gone crazy, you know. And okay, perfect. That kind of hopefully will set that one.
Well, and I'll add this, Gary. I tell my patients every day, because I have been asked about that would raise, legitimately concerned patients have raised that concern. I said their phone is tracking them daily. So if they're concerned about the government knowing where they are, technically they already do.
That's true. That's a good point. That's a good point. So I guess the other one is, we heard of the reactions that some people on a trial in the UK had, which they believe is caused by their allergies. What advice can you give to people who have allergies, whatever? I don't know if it's all allergies that can be problematic, but what advice can you give to people who may have severe allergies and this COVID-19 vaccine?
Well, I would say what is said to all people with allergies. If you have a history of an allergic reaction to a component in a given medication or treatment, don't take it and consult your physician. To say that therefore anybody with a history of allergies needs to stay clear of a COVID or any other vaccination, of course not. Right. If you can't take penicillin, it doesn't mean you can't take all medications.
Right.
There are some cross reactivities. I think this is going to, until we have further information, there is going to be pause for consideration for people with history of anaphylactic level i.e. having to carry an EpiPen type
Right.
reactions.
Right.
There again, not saying somebody allergic to peanut butter won't be able to take a COVID vaccination, but I think they need to make that decision in combination with their healthcare person, whoever,
Okay.
nurse practitioner, doctor. And, you know, probably those shots, like we do allergy shots, need to be administered in a medical setting, not somewhere casual, and that they need to be done in a setting where a reaction could be addressed if it occurred.
Siobhan, thank you. Thank you very much. If you had something, if I wanted to ask you if you had something final to say about this that could be reassuring for people who are listening to this, what could you say to everybody who never thought that March 15th, when we locked this place down, that 9 months later we'd be still dealing with the situation? Leave us with some comforting words.
Comforting words. Well, like I said, I think I reiterate what I said a minute ago, Gary, that Newfoundland has done an incredibly good job. This is not a mysterious virus. We know exactly how it works, and we know exactly how it's mysterious in the effect of how does it affect person A versus person
Sure.
B differently.
Sure.
But what is clear is that we are smarter than it if we would only use our brains. The virus doesn't have a brain.
Yeah.
We've got the brains, and that by very inexpensive and easy methods of protection, we have a lot of tools against it. Up to now, we haven't had a vaccination, but even until that vaccination comes, and even until everybody is on board, you know, who wants to be vaccinated and is eligible to be so, is protected, we still have the tools of social distancing, of cleanliness, of hygiene. Of,
Yes,
you know,
absolutely.
as difficult as they are, and as unpleasant as we all find them, we aren't out in the wilderness. So if we can just hang tight and hang together. I mean, that's the thing that I am so impressed by Canada. Not meaning to disparage my
Sure.
second home, but
Sure.
the collective, the cooperative effort, the mentality of collective good, the willingness and you know, just heart to take care of each other and to do what's necessary. I think that's what I just have tremendous admiration for. And that's where I think Canada is going to, Newfoundland specifically, but Canada in general, are going to come through this.
I guess what you're saying is we have more control over our health and this virus than we give ourselves credit for.
Exactly. Couldn't have said it better. That's exactly what I mean. You know, we're terrified. We're sitting in the corner, but we actually are more powerful in this than what we know.
Let's use our power.
Yeah, exactly. Together.
Yes, absolutely. Siobhan, thank you very much. Nice to see you again. Have a good Christmas and have a safe trip home, and hopefully I'll get to see you again sometime.
Hope to see you at the Y.
Absolutely. Okay.
Okay.
Okay. Bye-bye.
Bye.